Good evening, ladies and gentlemen, and welcome to the Edenton Town Council special meeting followed by our regularly scheduled committee meetings. We have agendas for tonight if you'd like to pick up one in the back. We'll start off with our special meeting, which has two items. One having to do with a continuing review of employee health insurance plans that we've been investigating since the present provider increased our overall premium rate by approximately 25%. We've been fortunate to find and get in a working arrangement with the Soaring Group, and they're back tonight for their second visit. We had a good conversation and exchange of information in a visit just a few days ago. So, gentlemen, Rand and Ed, welcome back, and the floor is yours.
Actually, Mayor, if it's okay, I'll
Sure.
start off with a little overview and want to let you and the council know that Rand and Ed, but particularly Rand, has been working extremely hard since he left your meeting last Wednesday. We've been emailing and conference calling and trying to get a proposal with Blue Cross Blue Shield. They are the provider that is offering us the best option for our employees. But to structure our plan in a way that meets a couple of the concerns that we heard from you all last Wednesday night. We are working on making sure that we include from the get-go the flexible savings account, the healthcare savings account. So we are going to be able to provide that to our employees. The other thing we heard was a sensitivity to our employees that purchase dependent coverage for their families, for either a spouse or for spouse and a child, or family coverage. And when we look at our profile, 35% of our employees purchase some sort of, purchase health premium to cover either a child or their family. And when we talked last Wednesday, we learned about the option really for us or for you all to set the rates. You could put the rates so that the bulk or the majority of the cost is borne by the dependents, by the retirees. And really, when you look back and think about how the league structured the funding of the plans that we've had in the past for our retirees, a lot of the burden was shifted to them and their families. So Rand was able to put together a proposal that we can show, that we'll show you tonight, that almost holds our employees who purchase the coverage for their families at a rate of what they're paying now, which you all saw, and it is very expensive. But the cost to them, if we looked at loading the plan more towards the coverage, dependent care coverage, was some employees were going to see over $1,000 a year increase, $100, $150 a month increase in what they're paying. And when I looked at it and broke it down by numbers, if we can shift a little bit of that burden back to the town, it would cost the town about $33 per employee, all of our employees. $33 per employee per month to try and shift that dependent coverage to the town's responsibility. And that would be about $21,000 to the general fund, about $4,200 to the water and sewer fund, and about $4,200 to the electric fund when you annualize it, $33 per year. Now that's on top of, what the new premium cost would be. But when I look at, our families, of our problem, and you heard about our problem last week, we have a terrible claims history because we have an aging workforce, the town does, and you've heard us talk about the programs that we've implemented to try and address some of the problems from not so much our aging workforce, but some of our other employees with high blood pressure, high cholesterol. We have a number of employees based on the wellness assessments that are pre-diabetic. We know we have a number that already are dealing with diabetes. And we are an obese group. That's what our profile is, and all of those problems contributed to it. So we're at a point now where I used to think, well, the insurance companies were just trying to make money off of us, but when we look at the history of our claims, and the league last year, and the trend has been, we've had terrible claims because we have not very healthy employees, and we need to do more than what we're doing. I'm proud of what we've done, but we need to do more. And I think this year, trying to shift the terrible cost increase that we're about to incur away from our families. You know who our families are. There are young employees. They're so busy working hard during the day and running around at night trying to take care of their families that they're probably the ones that are not causing the hard claims. So it's my recommendation that we look at the policy or the plan that would, for this year, do something a little bit to help our families with dependent coverage. Certainly look at directing me, directing the staff to really do some things. And I'm hoping that Rand and Ed can help us out of the box this year so that we can try to make a difference not only in our employees' health, but to really lower our claims. The urgent care facility coming, that will help some. And there are other things that maybe we need to really look about. We talked about maybe some cost shifting, not this year, but maybe next year. Maybe all of us who are on the plan need to look at contributing a piece of the premium. But I think this year, looking at where we are with the league telling us a 25% increase, and actually it was a 36% increase if we look at trying to change plans with them. So I think looking at what Blue Cross is offering, to me, addresses the concerns that you all talked about the other night. So at this point, I don't know if you want to ask.
Real quick, just give me those numbers again, the 21,000, and then what was the other? That was out of the general fund, is that correct?
Yes, 4,200 in water and sewer, and about the same in electric, 4,200. Now this plan, as you all heard the other night, is premium that dramatically changes our deductible, but then the town would purchase that gap insurance, to help the employees avoid having such high deductible. And I'm not sure, we try to make it available so that the audience can read it, but you all have a handout. Did you want us to go over that sheet with you with the latest premium?
Well, we have two sheets, two sets. Are you?
I think if you look at this separate one.
That's what I want to make sure
Yep.
we're on the right
and
page.
Actually, go to the second page.
Yeah.
And that is very similar to what we looked at last Wednesday night in terms of the format. It shows our current rate with the league, what we're paying this year, and that, of course, is going to expire June 30. What the league's renewal rate is in the second column. And then in the third column, you're looking at the Blue Cross rate. And did you want us to try and review all that briefly, or you want a minute to digest it?
I can't digest this stuff without a review, so I would vote that we be walked through this process, please.
Good. Well, Rand can do that for us, Mayor, is that okay?
And
Sure.
do these Blue Cross Blue Shield rates, the side that I'm looking at all the way to the right, does that include the gap insurance?
The rates on the page that Anne Marie referenced do not, but the cost exhibit pages, when we're looking at the town dollars, do include the gap insurance, because what we're proposing is that the town purchase the gap insurance. So if you're an employee or a family member of the town, you're not going to see that cost on these rates as much as the town's going to see it on the totals. Does that help you?
Where do we find those rates? I mean,
It would be on the first page. You have two attachments. The first page that's more half a page, so to speak.
right.
This is more meant to show you what town dollars are at stake, depending if we go with this scenario versus the other one. And the highlighted being annualized, everything assuming certain membership today that may average over the course of a year, annualizing it based on some assumptions of how many prescription drugs might be filled. But at the end of the day, what are we doing to address the league's annualized $157,000 town increase? We can drastically reduce that before we even get into talking about the family members. But this right here is the same plan and arrangement that we talked about last week. We're just moving the dollars around a little bit differently. And that might be, as the mayor said, what I'd like to explain page by page, but not take up as much time as I can talk. I'd just assume take questions, but I know some of you who weren't here last week, and just in general, we start talking about deductibles and coinsurance and gap plans. It can get a little bit confusing, and we do it for a living, so it's okay. But let's just look at what I was just referring to. This is Anne Marie's kind of recommended proposal, if you will, which is a combination of the Blue Cross Blue Shield, the plan design that we discussed last week, with the same gap plan through Assurant that we discussed last week. The gap plan being funded by the town, meaning essentially where if you're a member of the health plan, whether it be employee or retiree, if you're a member of that Blue Cross plan, the gap plan is intended to pay where your health insurance does not pay. And so if your current plan has a $500 deductible and the new Blue Cross plan has a $5,000 deductible, and you have an inpatient hospital procedure where generates a Blue Cross explanation of benefits saying Blue Cross pays after you've spent the first $5,000. Well, the gap plan pays the provider that $5,000. So essentially, in the inpatient example, you could have a scenario where someone's even better off than they are today, but they have a separate outpatient potential benefit of $2,500, and that could be things like the emergency room, but more like outpatient surgeries and MRIs and all the things that go towards your $500 deductible today. Now the gap plan pays the first $2,500. So when we look at a 25% increase and try to create this win-win, we're trying to create a win for the people and a win for the town. And so where we were last week was we had a win for the town because the rates were loaded on the family tiers, but the employee-only rate was so low that it looked even more attractive than this page here today. even after paying for the GAP plan and the HRA pharmacy component. We, over the last week, have worked with Blue Cross to try to level that out so that it may not be a win-win, but how can we collectively create the best with what we have to work with? Meaning, it could cost us every dollar that we save the family units, it costs the town the same relative dollars as a proportion of our membership. And so, like I told Anne Marie, there's really no right or wrong answer, or it's not for me to recommend as much as it is for y'all to collectively kind of be in this together. The wellness-centric approach to, in order to get as close to a win-win as possible, we also have a few extra moving parts in our plan this year. It's not quite as rich or black and white as what everybody's used to, but that's going to encourage a lot more employee education, engaging your people to know what we're doing and why, how long we might be able to afford to do it, where the money's coming from, what we're facing ongoing in terms of being in it together to get healthier. And we're not singling out the old people, or we're not trying to overly compensate the younger people. It's just trying to create that win-win, and what is the balance? So this page here tilts the balance towards any of the employees and or those with family member coverage and retirees, all, we hope, feeling like we've done the best with what we have to work with. The problem maybe is that you do still have, as a town, an annualized new six-figure expense compared to what you're paying today. And I'll probably stop with that, and looking at this, do y'all understand, or would you like to ask some questions about these numbers, how there's the Blue Cross premium, then there's the GAP premium, and there's the pharmaceutical reimbursement projected expense. It can kind of be overgeneralized on this one page, so I just want to be quiet and let y'all ask some questions in terms of that.
I have a question of Murray. Murray, can you turn his mic up a little bit? Is that possible?
Anne Marie has that.
Chief, can you help me? Glenn's out at the generating plant. We're running a peaker, so maybe Chief can do that.
So the $110,000 is the new six-figure number, right? The GAP cost. It wasn't here when you were here last week.
It was here, except what we did was we combined the GAP cost with the HRA. We wrapped it all into here's what the total annualized. So nothing is new this week, as much as the Blue Cross rates are more redistributed, and the retiree current and renewal rates were being factored into town dollars as a function of totals, when in fact we found out that y'all pay up to the, what you pay for the employees for the retirees. So when we made that adjustment, that also kind of cut into the savings a little bit. It was roughly a $20,000 or $30,000 overstatement of expenses by the town based on what we were showing last week on your current. So when we adjusted for those retirees, then it just widens the gap a little bit. And the reason we're only showing just this plan, being the GAP approach versus the other option we showed last week, which was a health reimbursement account, which would have been in place when the employee exceeded their $500 deductible, the town would pay up to the $5,000 or whatever it may have been, was that we couldn't quantify that risk. It would have put the town in danger of maybe seeing a seven-figure exposure. So the reason for the GAP plan and it being $110,000 is so that it's not as much our concern if, when, or how much of the big dollar usage occurs. Since we've had so much of that in past years, we couldn't feel comfortable putting that risk on the town until we kind of get a better handle on, changing some behaviors or just knowing what we're dealing with. Assurance going to pay that provider beyond whatever the amount that Blue Cross does not pay. And the idea with the pharmacy component is we're estimating, one of the reasons we're able to get Blue Cross to be attractive, a good, reasonable plan, is that their pharmacy plan takes out the copays and says the member has to pay up to $100. We know that's not going to be popular, so we're putting the copays back in and using just a third-party card, which is a reimbursement account. The difference is the town is only on the hook for the difference between the copay and the $100 cap. So the employees can keep the copays that they're used to today. It's just that they're going to present an additional card, and that the town will have to pay maybe $50 to $60, give or take, per brand name prescription filled. So that risk is a lot smaller and a lot easier to quantify being comfortable with compared to the thousands of dollars in a hospitalization.
Does anything on those 2 pages quantify what you just said?
I believe the best way to quantify
I'm
it...
trying to figure, work with you, but I'm...
Sure. Let's just go from the top to the bottom on the first page again. I apologize.
The first page being short.
The short half a page. So
Yeah, let's do that.
if we look at assuming the town's going to pay 100% of the employee-only Blue Cross premium, and we assume we've got a total of 83 employees and or retirees, that's probably different today than it was a month ago, but that's what we're going to use. That Blue Cross cost to the town on a monthly basis, you'll see in the third line down as monthly town Blue Cross employee only cost as a $47,280. Or if we were to have 83 employees and or retirees, you annualize the next line down, you see 567, 361. Now we realize your membership's going to fluctuate, but we have to just use something based on a snapshot. If we have a few folks leaving or no longer eligible, that number goes down just the same as if we hire some people and if it goes up. So then at that point, that's your Blue Cross costs. That's the most you're on the hook for going out as a town to Blue Cross. Family members, as they have in years past, have a payroll deduction for their costs. But what's different about this year in addressing the cost is the 110,000 figure on the next line. That's assuming we actually, as a town, not just provide, but pay for the total cost of the GAP plan for employees and their family members. So that we're filling in the risks of everyone's GAP and not just the employee only. And that's what's different and harder to wrap our head around compared to years past. It used to be, we're going to do this for employee only and we're going to do that for family. In terms of the GAP, we just couldn't give family members a $5,000 deductible and give them the option of maybe, having a payroll deduction. We said, let's try to make this as close to what they're used to as possible. So we have to add that into the town budget. But then the pharmacy reimbursement program I just described, we have a generic copay just like what we're used to. That's Blue Cross, but any member who gets a brand name filled, the town may have an expense, depending on what type of brand name, between $40 and $60 or $80 maximum, depending on the cost of the brand. We're just going to say if, as a town, we have 50 brand prescriptions filled per month, which we hope is somewhat conservative because there's a generic for so many options out there, then the town may budget another $40,000 of reimbursement funds for pharmacy. And that is solely there to make sure the employees keep their drug copays. And really, with the reimbursement structure, we'd prefer just to have a Blue Cross copay plan. But Blue Cross gives such a rate discount for having this maximum up to $100 when you remove the copays. We're taking advantage of roughly 15% savings to just pay a third party to turn around and put the copay back in. And again, when we have that win-win goal with a 25% increase, we have to do some things that ideally we wouldn't have to do, or like to do, but an extra card and a little bit of employee education, if it means, upwards of $50,000 for the town and, the hundreds or thousands for the people, then maybe it's worth it. And that's part of, like Anne Marie said, changing the culture. Even just having another card for a brand name drug. Well, do I need this brand name drug versus a generic? And asking their doctor, having those conversations. That'll control our costs at renewal next year. Not just the reimbursement cost, but how does the health insurance company look at us collectively if we are lowering our brand name utilization versus just the same lowering our emergency room utilization or improving our high risk. But I was going down the claims conversation again. Did I answer your questions on the numbers?
I think. Could I ask you one? Okay.
About as well as I think.
So what you're saying is we pay, X amount for our employees, and then if they have a spouse or a child on there, then they pay the Blue Cross Blue Shield amount. And then what you're saying is that with this gap amount, we cover those dependents.
You at least have a secondary policy that covers the risk the new policy creates. So the Blue Cross.
But are we paying the premiums for the spouses and the dependents at that
for the
point?
gap plan only?
Okay. And what, I'm just curious.
Yeah.
Tell me, what is that a normal thing or?
It's really not. Flip to the second page now, then, and
that's $110,000 a year, right? Okay.
So, to your question, is that a normal thing? No. We've noticed early on the town of Edenton is not a normal, situation where let's look at the bottom line and let's transfer costs onto our people or what we're used to working with, unfortunately, for-profit businesses or, municipalities in some cases that are just looking at that bottom line. What we saw was this solves the bottom line problem with this gap plan, especially if we just pay the employee-only cost, just like what we're doing currently for the health insurance. And that employee-only has that gap filled. But the cost or the risk that, like Anne Marie said, 30-some% of our people are covering family members, those people would now go from a $500 deductible to a $5,000.
Okay.
And so at that point we said, can we not take a little bit off of the bottom line and fill their risk just the same as we're trying to for the employees without putting a new additional cost from their paycheck?
I think the big thing, we of course there's a lot more moving parts, and we didn't do it because it was fun. But the gap plan and the drug card plan are cheaper than if we got the same coverage from Blue Cross. That's why we went to the $5,000 deductible. And if we could have paid Blue Cross for the same benefits we're going to end up with, but you didn't want to pay what they would want for that amount. So by doing it with the gap and the drug card, we can get the same benefits for less premium.
So it's cheaper for the town to do it and be able to provide that coverage than it is.
Right.
Okay, that makes sense.
That was our goal.
Yeah.
And again, there's some moving parts, but as Rand said, hopefully the moving parts will also serve as an education to our folks about brand name drugs and generics and why maybe they ought to ask their doctor if there's a generic for this brand they've been getting. And some of those conversations will help us in the long run and hopefully help their health as well. And I guess one thing I'd say that we rearranged those premiums. Blue Cross said to us, for covering these people and these dependents, we want, and I don't know the number, $500,000. And we said, well, yeah, but we don't want to pay the high dependent premiums. And they said, well, we still want $500,000. You can move those numbers where you want them. So that's what we did when Anne Marie said, move them over to the employee side that the town's going to fund so that we don't put the people with family coverage so far in a hole. But Blue Cross is still getting their same dollars, so they're okay with that. So since we were here last week, we just had them readjust those, still the same premium they were going to charge us last week.
And that's, Mayor, I know you said, well, where did the money go from last week? you're looking for whether something was missing or not, but that was the biggest difference in the spreading out of those dollars. It leaves us, if we, as a town, make that decision with, even though it's much better than a $157,000 increase the league is proposing, it's still a six-figure increase. So this option allows the family members to keep their paychecks for health insurance unchanged.
So basically, with the load option, the family plan will remain the same.
The per pay period cost.
Yeah, per unit, employee and spouse, well, that, yeah.
There's a little difference in
Little
there.
difference, but not bad. Child and children, same, family.
It was built to be, as close to dollar to dollar.
That's with the 51 members. Is that right?
I think it's
Well, whatever the
55, including the retirees.
Yeah, there's still 4 more, yeah, 55.
We're all saying if we understand this correctly, and I'm going to say the same thing, if I understand this thing correctly, with the coverage that Blue Cross is proposing and the gap insurance together, we're still roughly $100,000 under what the renewal was from the league. Is that?
No, in this particular example, we're about 37,606 under what the league was proposing.
Under the projected from NC municipality, anyway, yeah.
So that number shrunk quite a bit when we made the redistribution. And so, of course, the second part of this packet, or the second packet itself that has more of the fine print, that everybody has a thicker, not everybody, but the councilmen, do y'all have a thicker version that you can maybe just take a glance at page 3? And this is where it's more of an even spread, where the town and the family members incur some of the burden of the increase collectively. It's not, as heavily weighted as what we just talked about. And just go down to the second to last line there, you'll see at the bottom right, this is the same exact plan, arrangements, and insurance we've already talked about, but you'll see the projected savings compared to the league renewal is just over $70,000. That's...
You're going to have to backpedal a second.
Sure.
Give me page 3 again.
Page 3 on that.
It should look like what we're going over.
Right, I got that.
Well, I tell you what.
It's difficult enough.
I apologize. How about,
Yeah, that would be helpful.
let's look at page 2 then, because that's really the first page past the cover.
Page 2.
There, and you've got to get your thicker
In the
packet.
big
In his
book.
thicker,
All right,
there you go.
got it.
And this isn't quite as organized as we would like.
That's all right.
Originally, this was our proposition.
Have patience. Okay.
We
Rand,
appreciate
before you
y'all.
start into that, I'm gonna let your sidekick be thinking about this for a second. What is the average deduct, since y'all do this so much? Do you know what the average deduct is for municipalities now? We're going to the 500 versus the 5,000 here. What would you say the average is?
For a
If you need to think about
municipality,
that, I understand. Or if you need to pull it up.
they're,
Or county or whatever else you're dealing with.
yeah, I mean, I'd say 1,000 is your deductible, but when it comes to co-pays and co-insurance and some of the back-end risk that's tucked away, it's really a pretty broad range. On average, municipalities have very rich benefit plans 5 years ago until things got tough and they just started having to chip away. First they'd chip away on the back end with the co-insurance and out-of-pocket, and then all of a sudden the deductible, and you're right at about $1,000 and more like a $4,000 or $5,000 out-of-pocket maximum. And so still it's a lot better than a private business when you look at those averages.
And those are without the gap plans So the total liability is falling on the employees.
And most municipalities still maintain that 100% employee-only commitment, but not all. Some have looked at actually putting more cost sharing on the employees' paychecks, but not very many. That's a small minority. So it's easier to address the plan design than the paycheck, which is kind of what we're after on these family components, just the same. But going back to
and are you seeing the percentages drop also from 80-20 to 70-30 or 60-40? What's the average there now?
municipalities still probably 80%, which is why we're trying to show you an 80%, and they used to be more like 90, but in the private business world, the averages are closer to 70%. The thought is, if you're going to have a big claim, you'll get there either quick or slowly, but you're going to hit the out-of-pocket maximum one way or another. So you can create some savings by lowering that co-insurance. But our goal is to try to build something, even though with moving parts, it wouldn't look and feel terribly different from a risk standpoint for the employee or the family member. But going back to this page 2 of the thicker proposal, if we're sitting here wondering how is $37,000 even really going to generate enough with the moving parts to, dive into this thing, well, you saw where we were last week, but really where we were until Anne Marie and I started working through some things this afternoon was more of a collective share where the employee only cost goes back down. You see now it's at $536.53. Is everybody with me where that number is?
Yep.
The numbers we were just looking at previously, it's roughly $33 more per employee per month, which is all town money.
Yeah.
And because of that, it's spreading more cost burden, not necessarily on the employee spouses, because we only have 4, but more on the employee child or children and families, where we have 16 employee child and 7 families. And the employee covering children would see a $44 and some change per month increase. The family would see a $115.69 per month increase. But if you see just in the middle what the league plan was proposing, where they had no flexibility of shifting these dollars, now the family was going to see a $1,465 total, meaning almost a $400 a month increase. And so even if the dollars aren't as big for the town on the first scenario that absorbs all the dependent costs, they're just as importantly big for the family members, regardless of which variation we go with. The league is so far off on those levels, and they just don't have the flexibility to get us there. We can say the thick packet is option 2. It's the same exact plan, same gap, same HRAs. Now you're saving, if we flip over to page 3, you'll see the same cost exhibit that we went over for scenario number 1, but now the town has saved, annualized, your bottom right number, roughly $70,000 from what the league proposed increase was, not to mention the hundreds and thousands that the family members are saving. And this really isn't even where Anne Marie wants us to be or where I would want our family members to be, but it's just to show you that if the dollars aren't adding up compared to the league, they are there. They're just as much there on the dependent levels. And you can kind of think about that win-win of what the town can afford. But if we look at this scenario, they're more town dollars, but they're coming right out of the pockets of the family members who are covered on the medical insurance. So it's whether or not we share in the increase collectively, dollar for dollar, roughly, or we heavily help them pay for that increase at our own expense so that their non-employee only rates stay the same, and we're roughly spending $33,000 to do that, or let's just call it.
$33,000 is the cost to insure with the gap insurance the employees. Is that, the employees' families, not the employees.
No, what I'm addressing right now, and I use the number 33, but it's not on here. You'll see 70,000 is the savings if
You got that.
we spread out the family costs
Versus the league.
versus the league. But what we went over initially, 37,000 was the savings because we were keeping the Blue Cross the same as what they're paying out of their paycheck for family members. So it's nothing to do with the gap as much as it is if
Subsidizing the premium.
it's for an extra $33 on the employee-only rate, which is town dollars, we can keep
They
the,
just change it where the premium goes.
exactly.
I guess what I'd like
I
to
think
know
it was a
is,
very creative approach to it. at
yeah,
this
I do
point.
too. I'd sort of like to know what that subsidy is. You know, how much are we paying, not saying whether we should or shouldn't, but how much are we subsidizing that, you know, employee's family and just in numbers? I mean, you know, if you had a round number.
$32,978.
That's what
There you
I
go.
thought he was saying. That's the number, okay, that's what I needed to know, okay.
And really, it might not be the employee spouse as much as it's really heavily on the family rate where all those dollars are.
Do we have a situation where they choose this insurance over the ones at work? I mean, I'm wondering if, do we have employees that then say, well, I'd rather be on this one than take advantage of one at my own work? Does that make sense?
Can you help me, Tammy, with it?
If, let's say, you know, my wife's a school teacher and I choose to have her on this plan rather than a private company would be a better example. You know, she worked for a regulator.
Because our plan may be better.
Yeah, I mean, is that, okay, so I mean, I think that's interesting that we would then subsidize when our plan's better, but I mean, I'm not saying we shouldn't.
Well, here's what I think, Sam, but we have a situation here now where we have to decide whether or not to go with the league or with the recommended plan that the Soaring Group has brought us once revised here tonight, because we're out of time. We have to do this to get coverage in place by, what, July 1?
July 1st.
Okay, and so the options are becoming more clear. And what I'm sensing here, and correct me if I'm wrong, is that we're paddling this canoe against the current, and we're trying to keep things the way they were in the midst of a sea change within the industry. And I don't know that we're going to be able to do this the next time you guys come in here and make a presentation. Am I right?
And that's to Anne Marie's point, if we create that expectation that, yes, sir, you are right, because we've seen the claims and we've seen the trends continue to go up, not just with your group, but everybody's aging population. We have to do everything we can within, you know, the community to address our health. There's certain things that are still going to be out of our control this time next year.
Right.
But, you know, who's to say what that figure will look like or which insurance company will be interested in us? And we don't like to change everybody around, especially if y'all's background, y'all haven't had to make a change in a long time. So we hope that what we have is at least our best chance at a, you know, A+ rated carrier, and an arrangement that the employees will get used to, that, you know, knock on wood, with some management of our people's health, we budget for something reasonable, because we're trying to reverse, at least I told my dad on the way down, we're trying so hard to be conservative in this with the uncertainty that still looms.
Oh, yeah.
And the only thing I could tell him is I said, well, I don't think our claims can get a whole lot worse. And so
Yeah,
we got
'cause
that
what
going
I'm
for us.
thinking is that we as a governing body are going to need to address our policy going forward. I mean, y'all have done a wonderful job in presenting us a plan as far as what we can do to keep things relatively the same with the many moving parts that you've described here, both last week and this. But it seems to me going forward that we're going to need to address this as a governing body, policy-wise, is can we keep on doing this?
Right.
Right now, you've shown us a way that we can save money in two different ways compared to the League of Municipalities coverage, which we've been a part of for several years. But my sense is, that's why I've stated it the way I did, that this change is going to be more in place next year and more in place the year afterwards. And the challenges to keep things the way they've always been, I think are going to go away. So we have to reinvent our policy a little bit, I believe, to address that as well as come up with the best plan we can for now.
Yeah.
And I think y'all have done a wonderful job with that. I mean, but long term, I see it
I think you're
I
as a
think
big
you're right.
challenge.
Exactly, and we got a little bit of a late start to help you with that for this decision.
Right.
Not that you really, you see the best we got, but you're also seeing the problems we've got.
Yes.
And I think between now and next renewal, we can have some better discussions and some more numbers for you to see where we're heading. We'll also have some claims ideas, and we'll have a year to work on it. Not that we can keep it from going up,
Right.
but at least to start thinking about changes to the benefits and premiums.
And it was a big step just, through the league for almost everyone to get their required preventative screenings just in the last 12 months. That's a start. You're not going to see the, return on investment in this renewal, but I think you'd like to think that we will. And it's a commitment to a change in culture and behavior to try to address what's going on, and not just y'all's town, but everybody else.
Do just what you're saying is say, well, we've been great, we love this plan, we've had it, but we've had it now for 10 years or whatever the time is, and the days of $100 deductible or even a 500 are long gone. All of a sudden, I mean, in the last 2 years, all of a sudden they've disappeared. Except for municipalities and certain businesses like that.
It's, a move towards transparency in this industry, because one of the bigger problems with this industry is the consumer is not always the payer. So over time, when that card all of a sudden means $20 is what it costs for X service, they don't know that that may be hurting us as a town in the thousands for, whether it be the emergency room or the brand name drug. But the more we have these open conversations without telling people, hey, they need to get the care they need, go get it. But at least they understand the reasons why we're having these conversations, and we're given the education to make their choices a little bit, more transparently.
Anne Marie, do you have a recommendation you would like to make? Because I sense that in all seriousness, we do need to take action on the best plan as our staff and our consultants have brought forward, because we are out of time for this year.
Mayor, we have given it a great deal of thought, and, excuse me, I'm sure I'll take over me. The $32,000 that it will cost the town to help our employees with family coverage, it would be my recommendation, and I would work really hard with the department heads to find that money within their operating budget, that will not be an added expense to the budget, that we're going to have to cut and look at what can we not spend, what can we do without, to try and come up with that piece of it. The next item on the agenda is an overview of the budget, and we're really waiting for tonight to try and get some final numbers. We have some numbers plugged in, and there are a couple other moving parts. But that would be my recommendation, that we go with this option. But I can commit to you that we will find the funds within each of the departments' budget to cover that $33 per employee per month for this year. But I agree with what you're saying, that next year we are going to have to look at making some changes. We're going to talk about it with the employees. We're going to have to set expectations that health insurance is a wonderful benefit, but there's got to be some sharing in that benefit.
Okay, thank you. The chair would entertain a motion that we accept the recommendation of Anne Marie with the revised policy as it was presented here tonight by the Soaring Group.
So moved.
Second.
Okay, we have a motion and a second to that effect. Do we have any further discussion?
Mayor, I don't have a discussion, just a comment. I really want to thank you guys for what you put together here. And I think we really need to express, you know, how much we were looking at. I don't think that we got that out the last time, that we were really looking at a huge increase had we stayed where we are. Y'all have saved us some money. We're able to keep the same benefits this year. Whatever we do next year is next year, but I just want to say thank you, because y'all have been on time and shown a lot of good talent here. Thank you.
Thank y'all. Y'all been a challenge.
I can believe that.
Not Anne Marie and Tammy and Randy, just the risk as a whole. Everybody's been great to work with.
It's been great training for Ann.
Well,
Any other questions or comments on the motion?
I would like to ditto what Steve said. I certainly appreciate all the hard work that y'all have put into it. You spent a lot of time in it. Anne Marie spent a lot of time back and forth with you guys. And as Steve said again, you have saved us some money, and we certainly appreciate it. I think the gap insurance is certainly a big help to the employees, because we've got some employees that $5,000 would totally devastate them. You know, so I think the gap insurance is a tremendous help. And thank you.
well, and within y'all's packets, there's more of the, details and fine print to the Blue Cross, the gap, and ultimately, the reason why we like this gap is there's not much fine print. There's no, gotcha pre-existing conditions and things that we hadn't talked about within the budget. There are a lot of other plans that are. After I stop and let y'all go into budget conversations, the next thing we want to do for y'all is let us start engaging your employees, and not just this medical conversation, but over the next weeks and months, get to know us. We're here to help, and we work for them and for y'all, not for the insurance companies. We see that there's a lot of overselling of insurance in some of your Colonial and Aflacs, where the employees' paychecks have gotten really eaten up by insurance they probably don't even remember they elected or don't know how to use. We're going to have these one-on-one sit-downs to talk about these changes and a few extra cards, but talk about wellness and all the other things that maybe we can do to preserve their paycheck. It all is part of this service we hope to provide y'all.
All right, Councilman, any other questions or comments? All in favor of the motion say aye.
Aye.
Any opposed, no. Carries. Thank you all again very much.
Absolutely. Thank you.
It was a cram course in insurance policies and changing landscapes.
And we didn't get to talk about the FSA, but I'm going to just tell you that it's in your packet at the very end, and it's very affordable if that's something we want to do now. I know there were a few councilmen that had requested that, whether we do it now or later. It's an advantage for those employees, family that take advantage of it. Okay. Probably a couple $100 a month. Well, the town has to spend an admin fee of a couple $100 a month for providing access to that type of arrangement.
As soon as we hear what our budget is all about, we'll give you a call.
It's kind of like the dental insurance. It's down here compared to that big medical number.
Yeah, right.
Well, it could be a huge savings to all of our employees if they would use it. If they learn it and use it, it could be a huge savings.
I think it's something y'all can vote on amongst yourselves between now and, say the middle of the month, whether we do it in conjunction with or a month later.
Okay.
Thank you.
All right.
All right.
Thank you.
Thank you.
Thanks
so
again.
Much. We'll get out of everybody's horn.
Okay, returning to the agenda, item B in our special meeting is an overview of the proposed budget for the coming fiscal year. And Anne Marie, I'll turn that over to you and
Okay, it will be brief.
Randy and whomever else.
It will be brief, Mayor. We will, thanks to you all making a decision tonight, be able to plug in the final numbers. And My goal is to present the budget to you in the next day or two balanced, and I am looking at recommending a budget that includes a tax increase of 1.5 cents, and I can point to two things directly that attribute to that 1.5 cent increase. And you've heard me preach about it the last couple of months, and you all are aware of the loss of the $60,000 in tax revenue that came to the town through the administration of our privileged license program. Last year, the General Assembly passed legislation that required that license expire June 30. It has impacted municipalities in a different way. It really depends on the type of tax base that they have. I've talked to a lot of managers they were not generating hardly any money from it, and they probably didn't have a very big commercial base. But for Edenton, $60,000 is over a penny on our tax rate. And the General Assembly said that in the name of tax reform last year, they were doing away with this tax, but they would try to find a replacement revenue for us. There is slight hope. The General Assembly is still in session, and there is a piece of legislation that's been introduced that would give town councils the authority by resolution to levy a sales tax that would be used as a replacement revenue for this particular item. There was all sorts of hopes with the league that the tax would be reinstated. Of course, we knew that wasn't going to happen. The purpose of the tax is to generate, the privilege license tax was to provide revenue for a higher level of service that municipalities have to provide in the commercial district. We have different storm drain requirements, we have traffic, we have police. Fire is a huge impact, fire protection. But with this tax being gone, what will happen is it will be spread upon all of the taxpayers. It will be spread upon residential, industrial, and commercial if you approve the tax increase. The other loss that I'm forced to look at making up is a loss of about $20,000 in rental revenue that's gone, that we got from the Northeast Commission. That building is vacant and is not generating any revenue. As a matter of fact, the mayor was quizzing me the other day about our expenses on it, because we do have it covered with flood insurance. We changed the level of insurance last year to reduce our premium, but I think we're still paying about $2,400 a year in insurance on the building. So that's what we're looking at. And you all know about the electric fund, where everything seems to be a moving target this year, but we have been engaged with the consultant that you hired at the last meeting to work on helping us adjust our retail rates. But right now we're proposing the budget using the old rates until we get the new rates. And then in water and sewer, we're real close to being able to balance that budget. I think we got the numbers to work. So we should be in good shape with water and sewer. So that's sort of my overview, Mayor, and thank you for taking action on the health insurance, because that will help us finalize one of the big unknowns that we had. So thank you.
Okay. Thank you. Sure.
The tax that we could, the council itself could do just by resolution, if that passes, how much was that tax? Do you know?
I don't know, Steve. And I've asked the league to help us with some numbers about how much money, it would generate, and they were asking for some help from Fiscal Research, General Assembly, so I'll follow up on that. Yeah.
Okay, so stay tuned, right?
Yes, sir.
Okay. Okay, that concludes our special meeting agenda tonight. We'll move now to committee matters, beginning first with utilities. chaired by Councilman Quinn, please, sir.
Yes, sir. We have 3 items on the Utilities Committee. The first one is on the Power Agency ordinance to approve the asset purchase agreement between North Carolina Eastern Municipal Power Agency and Duke Energy. Can you lead us through that?
I will, with the assistance of Hood Ellis, our town attorney, is here with us, and
I'm so glad he's here.
yes, and he's been helping us navigate through this really exciting time for our electric system. And last week, or 2 weeks ago, you attended a special meeting with the town council from Hartford and heard a presentation from Graham Edwards. I think the big takeaway from Graham's presentation was that the town's annual debt service for the power agency's ownership in the nuclear power plants will decrease from, I'm looking for my notes, approximately, I should know the number, it was almost like $4.5 million a year down to almost $900,000 a year. So, and using the phrase that we used with insurance, the benefit is loaded in the first 10 years. The rate reduction that our customers will enjoy is for the first 10 years, and then after that, our rates will gradually increase, but they will increase at the same rate that Duke Power rates will increase. So it's a huge benefit to us, but it's a very, Hood, help me with the word, it's a very complex transaction that requires very specific motions and approvals of specific documents. And Hood and I haven't chatted yet, but did you want to just briefly review with them the documents that they're going to have to approve? And also we'll have...
Talk about boring. That would really be boring. The ordinance Anne Marie's put in your packet, that's what you're going to be called on to act on. And once you act on that and approve it, that authorizes the mayor and Anne Marie to execute all of the documents that are required by the power agency from the town of Edenton. And all 32 participants are being asked to do the same thing. And it's, you know, the agreements are agreements that terminate our existing relationship and start up our new relationship. One agreement, you know, gets our new, is us approving our new share of the debt and issuing the new bonds that replace it. We're selling our interest in the assets. The proceeds are going to pay down on the debt. There's still some little bit of debt left over. Like Anne Marie said, it's about 0.9 million. And our defeasance obligation through the debt part of this is financed again the same way with a 20-year term, I think is what they call for. But that's basically what the deal is, and that ordinance outlines the agreements that we approved to get in the new relationship.
And we are going to have a public hearing. We've advertised there'll be a public hearing on Tuesday, June 9th. And all of the documents have been posted on our website, and if anybody wants to review them. And just also remind the public that the council hired a consultant, an independent third party, to review the economics to review the proposed sale, and then also to look at the economic benefits that were used to calculate the savings. And that report was received by the council several weeks ago, and it was really an interesting report. It served as an executive summary, I think, that helped us understand the deal a little bit more. But it confirmed all of the economics and the assumptions that were used by the agency and their consultants to put together the deal.
And one of the other points that y'all remembered as well as I do, but is that we won't own nuclear facilities anymore, so that risk will be gone. Unlike Duke, who can pass its risk on with the simple stroke of a rate increase, we didn't have that ability. But the consultant's report is very well written and pretty understandable. And is that on the website as well?
I think it is. I'll double check and make sure. Thank you.
But
That's a good point.
That's the easiest way to try to understand each agreement.
So,
No, we don't
Councilman, I think
exercise that tonight, do we?
you do not, but I think it would be appropriate for your committee to recommend that the ordinance be placed on the agenda for the regular meeting of June 9th.
Yes, I do that. I do.
Okay.
We have, John Norris is going to update us on the water system therms. I assume you're going to do that,
Yes, sir.
Mr. Norris.
John, you want me to help you with the,
Yeah, I just need to pull out.
I see. Are you going to use the, you want to use the clicker?
Sure. Okay, good evening, council, town manager, and everybody in attendance tonight. This is a sequel to the THM report that we gave a month ago or so. As you all know, we're in violation of THM concentrations. A little bit of this will be a review, but this is just to kind of update everybody on what we've done and where we're going and how we've gotten to this point. So THMs, they're trihalomethanes, byproducts from disinfecting with chlorine. Chlorine reacts with naturally occurring organics in the source water to create THMs. Disinfection is necessary to protect against disease-causing organisms and pathogens. They protect us from acute threats to humans, meaning they can cause immediate illness. So it's very important to chlorinate our water. The EPA does not recommend against reducing chlorination or anything of that sort as a result of trihalomethanes, but they do recommend against different treatment alternatives, which we're going to talk about. And as we talked about last time, the trihalomethane concentration increases with the temperature, the pH, and the residency time. How do we get rid of them? How do we get rid of trihalomethanes? You can reduce the residency time. We've been doing a lot of flushing, but we've also been doing a lot of testing at the well sites and at the plants. And what we found in that testing is the trihalomethanes are being formed immediately after the plant. So it's not a residency time issue. It's not an issue of something way on the outskirts of town because, you know, that's the longest residency time. It's more of an immediate reaction between the chlorine and the organics in the groundwater. So we're going to continue flushing because that's good practice, keep the water flowing, especially at our dead ends. But that's not going to solve our THM problem. That was proven by the testing that we did. Harry Bailey from Potable Water helped us with a study, and he helped us with the testing and to determine where to test and when to test, and that's how we came up with that. Reducing pH, you can't really fluctuate your pH too much. And temperature, we can't really control the temperature. It would probably cost us a significant amount of money to reduce the temperature of the water. The water comes out of the ground at a pretty set temperature. Removing the precursors, this is one thing that Harry did look at and that we tested for. And we can change our treatment process, which is another thing we're going to be talking about. What have we done? We've increased flushing. We've changed our sampling sites prior to taking that testing at the plants. We thought, well, maybe our sites aren't representative. So we moved our sampling sites to more central locations that were more representative of our system. It did help, but it did not take us out of violation. We took the samples at the wells to identify those precursors. A short-term solution. his report came in, Harry's report came in, and he gave us a bunch of different options. Well, not a bunch of different options, a handful. The option that we all agreed on was the best option was to change to chloramine treatment. Chloramines are basically chlorine with the addition of ammonia. And it's addition of ammonia right at the plant, so that basically wipes out the trihalomethanes that we're testing for from being created. It is very inexpensive relatively to implement. It basically requires a shed, 8x8 shed, a tank for ammonia, and a pump. And we need to reroute a little bit of the water lines, but our guys in-house can do that. They've got skills to do that. And we put a mixer in it, and it mixes the ammonia, mixes the chlorine as it's leaving the plant, and it's ready to go. The downside of chloramines, and chloramines are used all over, in big cities, small towns, and with the introduction of the stage 2 disinfection byproduct rule, a lot of people are going to chloramines. It will need additional treatment prior to being used in a fish aquarium. It can have a toxic effect to aquatic life in fish aquariums, so they do sell dechlorination kits for fish aquariums. Dialysis patients, the dialysis place here would also have to modify the way they treat the water, probably add a filtering system to their treatment. They currently treat the water through reverse osmosis, I believe, there, and they'd have to add a filter to treat the water for that. It requires a lot more monitoring than chlorine. Chlorine is a better disinfectant all around. It's a great disinfectant, but when you go to chloramines, there's a greater balance that you have to keep, and it requires constant monitoring, and will require a little more manpower, but not at a cost, I don't believe, to the town. We're probably looking at cost, a very rough estimate per plant. We have 2 plants, probably looking at the $15,000 range for each plant to reroute the piping, get the pump, the building, and get everything set up. That's a pretty conservative estimate, so I think that should be a good budget number. Long-term solutions. Nanofiltration or reverse osmosis treatment. We have the Wooten Company working on a water study right now, and one of the things they're looking at is long-term solutions to trihalomethanes, total dissolved solids, and also conductivity or salt content in our water. And that's something that we're dealing with here right now. As I said, it'll address all of those items. And that's the last thing. It's very expensive. Very expensive, but I think all of the professionals that we've been talking with and dealing with, Harry and the Wooten Company, and talking with our colleagues in adjoining towns, it's inevitable that something is going to happen to address the saltwater intrusion that's coming into our wells. And as far as the dissolved solids, that's an aesthetics issue. That's what you're seeing on your faucets, on your toilets, and you know, there's no harm. It's not controlled by the EPA or anything. It's just what's precipitating out of the water. So that's more of aesthetics, but the conductivity is a secondary measure, and we need to watch that, make sure that our salt content sodium content is low, and the THM, obviously we're in violation right now. So all of those items would be addressed. Nanofiltration and reverse osmosis are very similar. They're more costly to operate. They're very costly to build and install the equipment, and they require a discharge, an NPDES discharge permit, and a very long pipeline to take it out to an acceptable location in our waterways. So you're looking at probably 5 to 10 years before we even could build one if we started right now talking about it, which that's why we're trying to get the conversation going. And as far as money, the best guesstimates that I can throw out there would be somewhere between $8 and $20 million for a reverse osmosis plant. So that is a very long-term solution. but I think it's something that we need to start looking at. The chloramines will definitely get us out of violation. There's no question about that. But I think we have an aging infrastructure here, aging plants, and we need to look at long-term as well. And that is all I have. Any questions?
The long-range recommendation with reverse osmosis and its high cost, since we are in a region that lives off the same aquifer, is this something that we could explore with other communities to spread the love around, so to speak?
It would be the perfect opportunity for a joint water system or a regional water system, and I think those conversations will naturally happen in the future.
Okay.
We kind of started to look at the option through our study because we were studying other things, just to look at the feasibility and approximate cost of that, and then we could explore further from there.
But you're comfortable with this 8 to 10 year period, or that would be a
5 to 10 years.
5 to 10?
From everybody I've talked to, the permitting process, because you're discharging such a high concentration, it has to be way out in the waterway, and every different agency has to do their study and make sure that everything's safe. And because reverse osmosis basically strips everything out of the water, and then you go add stuff back in. Whereas right now we have water that's coming out of the ground and we're treating it, but we're not stripping everything out of it. If that makes sense.
It does. Thank you.
So,
John, before you go, stay right there just a second. As I'm sure all of you know, we are losing one of our valued employees. John has been head of our Public Works Department for
4 years.
4 years, and he's done a wonderful job in that capacity. I mean, if he can come to a group like this, seated up here, and make a logical explanation of trihalomethanes, it gives you some idea of his capabilities in not only dealing with people, but also with very difficult subject matters that relate to the town of Edenton. He's been a tremendous asset. He's trained his team to an extraordinary level. They can do things that they never dreamed of doing in years past, thanks to his leadership. He's built up confidence in them and the work that they do, and we all enjoy the benefits of that and of his time spent with us in that department. So John, as a parting memento of your time spent with us here in Edenton, the council would like to present you with this really pretty photograph covered by this funky of our lighthouse and walkway out here on the waterfront, and we hope that you'll hang this in your new office down in St. Petersburg and remember the friends and the time you spent with us.
Thank you.
You're very welcome.
We have one more item, and disaster assistant agreements. It has to do with our movement with Electric Cities. And Bud Powell has put these together. I think we have Exhibit A, which we have to execute. Do you have the Exhibit A? Can we execute it tonight, or is it something that we would move forward?
If you would move it forward, and this agreement does not cost the town anything, we don't incur any expenses, only if disaster strikes and we need to call for
We need to call
help.
But it's a great function, and it's proved its worth.
It has, and the format will ensure that if we do have to call for help and incur costs, that and FEMA will reimburse us for our expenses. So we would ask that you move it forward. Thank you.
That's all from Utilities Committee.
Thank you, sir. Moving now to a Public Works Committee meeting, and that'll be chaired by Councilman Stallings, please, sir.
Thank you, Mayor. We only have one item on the agenda tonight. We've talked quite a bit about the parking spaces lease agreement for the Hotel Hinton. And tonight we have with us Bob Hauser. I'd like to introduce Bob. And Bob, if you will, at this time, go to the podium and tell us about this and where we're going and where we need to go.
Sure. Thank you. Good evening, everyone. Well, we have a lease in front of the town right now that's kind of moved around a lot over time, from the county and the town to now all the town. That entails leasing us 84 spaces in the parking lot that is still, at this time, part county and part town. So I can answer any questions about that. I don't know a whole lot more to say about it.
I would just like to add that since our last meeting, Mayor and Council, we heard concerns from, I guess, about 3 or 4 of the businesses on the east side of South Broad Street about the loss of parking spaces and their concern that it would impact their business. And so we reached out to the owner of a vacant piece of property that is adjoining the town's parking lot on Court Street, and the property is owned by Albemarle Bank. And when we talked to them about their use of that, what their plans were for that parking lot, for that property, they said, well, we would really be interested in donating that piece of property to the town. But we also have our eye on a little piece of property that the town owns that we would like to purchase from the town, and that is directly behind their bank on West Eden Street. And the piece of property, it's about a 60 by 60 piece of property, and it is currently not used for anything but holding our home to a town dumpster. So we're working and talking to the bank. We think it is a great opportunity. They would have to go through all of the procedures to purchase the property from the town under our statutes. They would like to be able to donate the piece of property to the town and do it in a way that might help them with some tax benefits. But that piece of property right now we think can add at least another 16 parking spaces to the public mix. So that would be almost a 30% increase in parking spaces. And it probably, we think, if we reconfigured it as part of our parking lot, we might even be able to get more spaces out of that. So I shared that information with the businesses that were concerned, and I gave them a copy of the lease agreement and the map and the proposed drawings. So you may hear from them between now and hopefully June 9th is when if you all agree tonight to move it forward, there will be a public hearing. We recommend that you have a public hearing June 9th so that if there is concern, you can hear that concern. But hopefully we've taken steps to address that.
And I dropped off a new map that includes that piece in the parking lot design and shows how it would all function with it. And I also sent, and I think Kraus sent to Hood today, the revised lease with a few tweaks that we made in the last week.
Emery, you might also want to share the statistics about that parking lot and how many of those spaces were used when it was used for the county office building and this type of thing, if you don't mind.
Sure.
Just for public knowledge.
For public information, the parking lots prior to the fence that is now around the former county office building, there were, I believe, 120
something, isn't it?
32 you got in here.
There were a total of 132 spaces. The chain link fence took up about 9 spaces, so for the last year and a half there have been 123 spaces. With the design, restriping, and then also the plan is to add shade trees so that the parking lot is in compliance with the UDO, we would create a total of 136 spaces. So you would get a few more spaces plus shade trees, and then add on the additional 16 spaces if you're able to work out an agreement with Albemarle Bank. When we were working back last summer with Saga on the conditional use permit that the town issued for them to operate the hotel, the zoning ordinance, if the hotel were located in a different zone, not in a downtown district. Downtown district, the town's responsible for providing parking. But had they been located in another zoning district where they had to provide the parking, based on the number of rooms and the size of the meeting space, they would be required to provide 84 spaces. In order for them to get all of their financing, the tax credits, all of the commitments, their financiers want to know that they have 84 spaces for their guests and people that visit the hotel. So that's where that 84 comes from. But I just wanted to point out too that when the hotel was the county office building, based on the number of employees that worked in the building and the average number of visitors that entered the building every day, that building should have had 150 spaces. So that's the type of parking demand that was generated when it was an office building. And my point is, I really believe that the parking generated for the hotel is going to be less demand than what we were used to seeing when the building was at its peak operation. I think that's important for us to remember. Bob mentioned that the lease agreement he sent, his attorney sent to Hood and Hood forwarded to me. There is a few sections that we're still tweaking. The lease agreement that you received in your packet, we highlighted those sections that we're tweeting, and there was one section that I was really concerned about, and when Hood sent me the agreement, I immediately went to that section, and when I read the language, it had addressed my concern. It was the section about if the hotel were to cease operating, you know, how did you define cease? And so Hood and I still have to review the final draft, but hopefully we're almost there.
Well, I think your point about if it changed businesses, it would have to go through the whole CUP process again as well and be determined what the parking would be, and so that's another safeguard there.
Makes sense. Bob, over the weekend, one of the council members asked a question about where you were with your financing. Is that something you're able to share with us publicly tonight?
I am. We have our tax credit financing with U.S. Bank in place. They've now come back to the table as we originally asked them to. We would like to do it all in one shop. They've come back to the table, and we are very deep in underwriting with them now to do the senior loan as well as the tax credit part of it. So we are, their chief underwriter talked to Prem Gupta, I believe it was Friday, and he is sending them the additional financial information that they asked for. So I feel like we're going to get a term sheet from them in the next week or 10 days. Yeah, it's been a process. I thought we would have it a lot sooner than now. All kinds of reasons. One of them, the least of which, was the state tax credits being pulled out of it, changed all the numbers. And your LTV ratio changes, the banks take notice. So we had to redesign a lot of things, and we work a lot of things, but you know, we were determined to make it work, and it's still working.
Does anybody else have any other questions or comments regarding this? Okay. Well, Emery, if we do go ahead and go forward with this and agree to lease the 84 parking spaces, and God forbid this happen, but their financing falls through and it does not go forward, it's null and void.
Correct.
Okay,
Right.
so we would not be losing anything.
Correct.
No.
Okay. Noel Jean, I believe you're on that committee, so if it's all right with you, we'll send that forward to the full council.
Yes.
Okay. Mayor, that's all we have.
Thank you. Moving now to...
Thank you, Bob.
Thank you. Thanks.
Thank you, Bob. Yeah,
Thanks, Bob.
good to see you again. Moving now to our administrative committee meeting chaired by Councilman Biggs. Please, sir.
Well, I think you all saw in your packet the two proposals that we have received for the old ice plant. As Anne Marie put in her memo, that she had originally planned to conference call with each developer, but that just didn't happen, which was, in her opinion, probably a good thing, because before she does that, it gives us an opportunity to either, if you've got questions, you can ask them tonight. Then hopefully she can get back with the developers, then if it's your wish, we will put it on the calendar for the council meeting for us to discuss even further. Is that kind of sort of what you wanted out of this deal tonight?
Well, do you want to, my thought was at this point, are you interested in interviewing both developers?
Yeah, I think we ought to.
Oh, I do too.
Yeah.
And-
So do we want to go ahead and set that up and?
Well, let me ask this question. You got two out there. Did you have others that just didn't qualify?
We had did one other look at the building but did not submit a proposal. Two others looked at the building.
And neither of those two submitted a proposal of any sort?
No, we had 8 or 9 that contacted us with questions, but they ended up not.
Well, did any of the, we can discuss this.
Please.
Is it, of the 8 or 9, I assume 7 to 8 didn't respond. Was there any hope of hearing from them, or do you feel that they just cut it off totally according to your conversation?
Body might answer that too, between us.
I think at least one is, it's just not his type project.
Well,
But he
yeah, but there
came and
were
looked.
several others. I mean, are any of them interested enough to come forward?
No, I think after they looked at the building and looked into it, they decided not to send it to them.
I mean, we set a deadline and got 2 proposals, and I guess we have to reopen that deadline if we wanted to get some more proposals.
One of my concerns would be, though, is did they tell you why they didn't present a proposal?
That's where I was going with that.
And if they didn't, can we write them and ask them why they didn't?
I know at least 2 told me it was just larger, it was a bigger project than they were comfortable with.
And then I think, I shared information with several people, well, actually with everybody that had expressed an interest in the Hotel Hinton. I think it was around 20 some odd developers. And for many of the ones that I shared, it was too small of a building. I mean, after all, if you think about it, they had expressed an interest in the Hinton, which is considerably larger. But it was good PR, and I think I was willing to do that and keep this community in front of these developers' eyes. So for some, it was just too small.
One thing I would like to address is that the Austin group has got in their budget state tax credits. Now, maybe they know some, maybe they know something I don't know, but,
They don't.
they're going to have to take that out, or, I mean, if that's part of their financing,
They've also got a payment for the building. They receive it back from the town as grant.
Anyway, so that's interesting.
And I'm not saying that's a bad thing, I'm just making statements like you did about the historic tax credit. So I don't think we've got 2 proposals. Is that sufficient for us to move forward and have somebody come in here and talk to us?
Yeah, I mean, it only takes one to do it, so
Keep in mind, we don't have to sell it
We've
at all.
only really got, I mean, reading through them, one is quite elaborate and a major maneuver, and it's $4 billion. They are obviously experts at doing this from the looks of their proposal. The other one is really minimal. I mean, it's,
But with no, it looks like with no borrowed money.
yeah, but I mean, it's not doing anything for the town that I can see. I mean, if this is not the occasion to have this conversation.
That's right.
Yeah,
I would think we just have both of them come in and
Yeah, I agree with that. I think that's the right thing to
Make
do.
some-
presentation.
Yeah.
I'm just looking for
Yeah.
something more to expect when they would come in.
let's let them come give the full proposal. How about that?
I think that makes sense.
Yeah.
That's all we have, Mayor.
Thank you, sir. That went so fast, I lost my place. Let me see.
That's easy to do.
Okay, Finance Committee, please. Councilman Dixon.
Let's see, we have two things on tonight. The first one is a capital project ordinance for the town of Edenton Police Station, which I'm happy that we're finally at that point. Do you need to, do you want to run through those figures, or you want me to do it? I mean, I think that basically what we've done is figured out that the architect's going to be $141,625, the land's $206,000, the furnishings and equipment are $150,000, the new construction is $1,652,000 for a total appropriation expense of $2,149,000. So I think we need to go ahead and send that up to full council so we can discuss it and make sure that's what we want. Okay. And the same thing for the, we have a capital project ordinance for renovation to the second floor of the town hall for a total appropriations, and finally, we've been working on this for a long time, for total appropriations of $248,345, and I will send that on to full council unless anybody has any objections.
No, I think that's right.
Oh, yeah, and then a grant agreement, I'm gonna turn that over to you.
Okay, and this dovetails on John's swan song. That you did do a great presentation, John, thank you. I never should have posted your first presentation online. I think that's what cinched the deal with St. Petersburg. They told me they did all sorts of research on John and on Edenton, and they saw his presentation that he did the first time on trihalomethanes. But as John mentioned, we are studying long-term solutions for our water supply, and you recall that last year you authorized us to seek an amendment to an existing grant that we had received from the old rural center, and we sent in all that paperwork and we were told it was going to be approved, and we just finally got the actual grant agreement in a few weeks ago. It is now going to be managed by Department of Commerce, so we need for the council to approve the grant agreement for that engineering report.
So we move that to full council?
Yes, please.
Unless anybody doesn't want to. Okay. I think that's it for the Finance Committee.
All right, thank all of you, and that's it for our agenda tonight. We'll close with a reminder that on Tuesday, June the 9th, Town Council will hold a public hearing, the purpose of which would be to listen to your comments relative to the proposed sale of the assets that are now owned by the member cities of electric cities. So anybody has an interest in that subject, wants to come and be heard, we'd be happy to hear from you. And that concludes our agenda for tonight. Thank you very much for participating, and we'll see you next time.